Right. Hi, everyone. I'm Rendy Murphy, epidemiologist and director of disease at the Mobile County Health Department, here to provide you a recorded update on the impact of the COVID-19 pandemic on Mobile County. So yesterday, 157 cases were recorded. That puts our total to 109,550. If you look at our daily report, you're going to see a gap on February 5th. There were no cases recorded on that day because the state health department made a system upgrade, and the records that were scheduled to process that day did not because of the upgrade, and so they have processed on a different date. So you will notice that there were no cases recorded on February 5th. We have 0 additional deaths yesterday, 15 additional hospitalizations, and yesterday the number of people in Mobile County hospitals with a COVID-19 diagnosis was 270. Thankfully, that number of people who are in the hospital has dropped back below 300, and we hope that it stays that way. If you look at our expanded weekly report, now that the month of January is over, we can see that, we had a record number of cases reported to us in January. This is not surprising. Almost a third more than were reported during our earlier record, which was August. So January will be the highest number of cases reported in any one month since the outbreak began. Luckily, we are seeing milder illness, fewer hospitalizations. We have seen what I hope is sort of a reduction in the number of people who have died with COVID. So hopefully we are past the peak of cases, hospitalizations, and deaths that are attributable to the Omicron wave, this fourth wave of COVID. So we do know a couple of people who died in January were infected with the Omicron variant. Again, about 1/3 of people who are hospitalized are vaccinated. About 2/3 of people who are in the hospital are unvaccinated, and the overwhelming majority of people who die with COVID are unvaccinated. So let's see. I think we've mentioned that some of the outbreaks that have been going on seem to be improving. Detention centers, nursing homes, starting to see slight improvements in the COVID outbreaks that have been going on there for quite some time. So that's good news. And again, remember the folks that are in nursing homes and long-term care facilities with COVID, thankfully they are much less ill than they have been previously, thanks to high vaccination rates and a less virulent Omicron variant. Just want to remind everyone that if you test positive for COVID, regardless of whether or not you have symptoms, you need to stay home for at least 5 days. And if you are exposed to someone with COVID, if you're up to date on your vaccines, then you can self-monitor, which means that you don't have to stay at home, but we just want you to wear a mask and monitor yourself for symptoms. If you're exposed and you are not up to date on vaccines, then we need you to stay home for at least 5 days and then continue to mask through day 10. Slight adjustment this week to our COVID-19 vaccination effort. We've been vaccinating 6 days a week at Festival Center, but due to sort of decreased demand for vaccination and more stressors on our staff, we're now back to doing community testing, so we have events around the community on many Saturdays. As the weather hopefully starts to improve, we may get busier. So on Saturday, we're no longer going to offer vaccination at the Festival Center. It takes, quite a bit of staff to open that place for just a couple of hours. So instead, we will offer any of the vaccine products at our Keeler Memorial location at 251 North Bayou Street. That's at our downtown location where I am now. And that vaccine will be walk-in and from 8 to noon. So as you go in, come in the main entrance on North Bayou, it'll be in the clinic that's just past the entry. Again, just ask someone at the front desk to point you in the direction of getting a COVID vaccine, and they will assist you in getting to the right location. So again, we will not be giving vaccinations on Saturday at Festival Center. Instead, we'll do that at our Keeler Memorial Building at 251 North Bayou Street. So there were just a couple of questions having to do with symptoms, and yes, there are lots of symptoms of COVID infection that also look like other things, like allergies, like flu. So yes, people still get flu and they still get other respiratory viruses, and yes, the some of the symptoms can be quite the same in general. If you have sort of a passing, symptom that sort of pops up and then goes away a few hours later, that's generally not something that might be due to an infection. But again, if you're vaccinated, you're going to have fewer symptoms and less severe illness. So it's still pretty hard to figure out if you have sneezing, coughing, runny nose, aches and pains, fever, those sorts of things. The only way you'd be able to sort of sort that out is through diagnostic testing. We don't have a test for everything. So the important thing is, if you are sick, stay home and try to not spread it to other people by wearing a mask and keeping your distance from people. So whatever you have, if you are sick, stay at home. And then there was also a question about additional boosters of COVID. Right now, there's no discussion about a fourth or fifth or next year, next flu season, booster doses for COVID-19 vaccine. Right now, what's being discussed is extending emergency use authorization for children between 6 months of age and 5 years old, so making those younger children eligible for probably what will be a 3-dose series of Pfizer. But I'm not hearing any discussion yet about what might happen, 6 months from now or next fall, about needing to get additional COVID vaccines or additional boosters, that sort of thing. I think just like it's been throughout the outbreak since it began, we'll just have to wait and see what comes of that, as we're still, learning as we move along in the COVID pandemic. So I'm going to stop there for today. We likely will be here again next Monday to give you an update. Submit your questions if you want in the Facebook chat, or you can send them into COVID-19@mchd.org. Again, COVID-19@mchd.org. So stay safe out there, everybody. Remember, get vaccinated, but continue wearing your mask. Keep your distance. Stay at home if you're sick. All right, take care.